I basically have always done general oncology, and I do a little bit of hematology also, but mostly just general oncology. I don't really specialize in any particular area. If I have an interest, it's probably lung cancer, and I actually serve on one of the national committees for lung cancer through the National Cancer Institute. So if I do have some kind of a niche, it's probably lung cancer, but really I do all kinds of general cancer work. Well, when I was a resident out in Boston, actually an intern out in Boston, I did a rotation in oncology, and it was one of those rotations where a lot of other interns and residents dreaded, but I actually enjoyed it. I loved working with the people, and I loved the patients, and I loved the multidisciplinary approach that seemed to be involved with oncology at that time, which was much different than other fields of medicine, and it attracted me to it, and I decided to pursue it further. You see things here that you don't see in the academic setting. Things present here differently than what the textbooks say and differently than what your professors tell you. And you really have to, you develop, I think, a little bit of a better clinical acumen about certain things. I think when you're practicing in an academic setting, there's a tendency to be in a silo. And I'm only going to do lung cancer, I'm only going to do GYN cancer, or I'm going to even specialize even further in lung cancer and look at particular targets in medicine. Here you have to know a lot, and you really have to be very versatile, and you have to keep up with a lot of different things. So in some sense, I think it makes you a better general physician overall being in a community setting. Since I started in oncology, practicing, 1986, that's almost 28 years ago now. I mean, we probably have 10 times more drugs now than we had back then. We have targeted agents, we have oral drugs, we have so many different options to treat patients and actually treat them in a more scientific and rational manner than we did when I first entered the business.